Age Tech Innovators.
Hello, and welcome to Age Tech Innovators, the podcast where we explore how technology is transforming the way we care for our aging population. I'm Monty, your host, and each week we chat with inspiring leaders who are making a real difference in the lives of vulnerable individuals, sharing innovations and ideas that help support and uplift those who need it most. Join us as we work together to build a brighter, more caring future for everyone. Now, let's dive in. So I have the honor of talking to Bob today. Bob, run me through who you are and what you do in between 60 seconds and 3 minutes.
Okay, well, I'm Bob Schmidt. I'm the chairman of 5 different companies in Cleveland, Ohio, in the USA. And my education includes a bachelor's degree in mechanical engineering, a master of science, an MBA, and a law degree. So I'm licensed both as an attorney, as a patent attorney, and as a professional engineer. My education came up through Army Corps of Engineers stationed in Europe. And then I worked in New York City for a while before that, and then got a job in Cleveland, Ohio. I was building refineries and petrochemical plants, and then went into the space business and built a water recycling system, and I designed a shower and a hand washer for the space station. And then I started my own companies in 1990. This is the way most entrepreneurs get started is they get fired from their old job because they were a pain in the ass to whoever their boss was. I always tell people, whenever I teach that never, ever quit a good job to go be an entrepreneur because it's hard. And so, those are the things that you look at. And I was fortunate that I had a very small nest egg from my great-grandmother that I was able to buy a 2-family house, used that to live free, and then bought another bigger house and rented out the 2 halves of the other house and continued to make money and live free. And so that gave me enough money to start my companies in 1990. I started Cleveland Medical Devices and Orbital Research in the end of 1990. The reason why I started 2 rather than 1 is because the medical area, you've got, that time you had 6,000 hospitals in the U.S., and as soon as you put out your shingle in the medical device area, you're going to get sued at some point. And so the liabilities and the marketing was very much different from defense, where you can count your clients on 2 hands, and you've got the U.S. government in between you and the potential plaintiff, so the liabilities are significantly less, even though you're maybe doing something inherently more dangerous. So my business model has been using America's SBIR program, Small Business Innovation Research, which is now about a $5 billion program to small businesses to help them fund new research. And in order to be able to do this, it's got to be, something significantly different from the state of the art. So typically by being in this business and submitting proposals that win, you've got to be about 20 years ahead of your competition in state of the art, which gives you somewhat of an advantage of the fact that you're doing something no one else is doing, but it's also a disadvantage because no one quite understands it. And so you've got to be, on the leading edge to be able to fully appreciate what's going on. But that excludes most of the general practitioners in the business. And so it's a problem of how do you get them to start adopting your new technologies. But one of the things that I have done is that I've been able to spin off several other companies from the first 2. So I now have 5. And in doing so, I was able to hire world-class engineers. So I had a woman who was Bosnian who worked in Serbia during the war, and being somebody that had 1 foot in both sides when you got shot for having the audacity to cross the street to get a gallon of milk. This is an exceptional woman, and she's just been doing a wonderful job with one of the companies. Another guy was from Paris. One of the presidents was born in Libya and grew up in Jordan. And so all these people came to America looking for education, and job opportunities. And so they were hired basically as engineers and then got promoted, to a manager, then director to VP. And once they had submitted their own proposals and got enough money to develop new products, we then had the ability to spin them off once they were ready for the marketplace. So, that's the model. It's significantly different from most people, but it's using these very bright people who want to be presidents of their own companies, but can't afford it. So I went 8 years without a paycheck hardly. And so, this is very difficult to start your own company. So this allows these people to get to that point. They don't own as much of the company as they would if they were on their own, but they also are able to pay their mortgage all the way through the process. So that's kind of my background and how I got to where I am.
That's amazing. There's a lot you've covered there. I wanted to say, firstly, I'm also a mechanical engineer by trade. It's my degree, and so it's really, really nice to hear that you go through such a analytical process throughout your career. One thing that stands out to me is you mentioned this process of using the small business innovation loans to create something which is conceptually new, and then you're finding exceptional talent from overseas to come and join and almost be the driver to push this forward. Where did this idea come from? Was this something you chanced upon, or was this something you planned in advance?
I guess I fell into it. I'd love to say no, I thought this thing through in advance. But, this is kind of what happened, is that people tended to seek me out because of the creative things we were doing. We basically invented digital wireless EEG. We had one predicate device, but it was the size of a microwave oven, and we shrank it down into the size of a deck of cards and made it mobile. And that's one of the things I used to do, is walk around with a wireless EEG machine in the 90s, where you've got these very sensitive amplifiers trying to look for brain waves on the surface of the scalp. So it requires large amplification. And then on the other end of that, you've got a radio whose job it is to shout as loud as it can. So this is the EMI problem personified with how do you do both of those things in the same space? And that's one of the problems that we solved.
So you spend a lot of time in new innovations and looking forward in order to ensure that you could get this money to fund these ideas. What are some of the other projects you've worked on, and have some of the projects you've worked on become more successful and other become less successful? And to add to that, are you able to anticipate when you come up with an idea which ones are going to go further than others, or is it very much how does it work?
Yeah. I found out that companies are like children, and that if you've got siblings or kids of your own, they all go off in their own direction. And as a parent, you can't really direct what your child does because they're going to do their own shtick. And so, this is what happens with the company. You follow the money and it changes. So when we started off with Cleveland Medical Devices, looking primarily at the medical device area, after a little while, we developed this radio system. And so we were monitoring missiles as they were separating from aircraft to be able to do that. So we got in the defense area for a while and then kind of got out of it. And the same thing with orbital research. They developed these dry electrodes for EEG and ECG on the body without requiring any goop. And so we built those, and then, after a while, we finally got out, and now we're back solely in the defense area doing drone work for the Defense Department in the U.S. So anyway, those are some of the things. Probably the biggest thing that we've done is this is our sleep monitor for doing home sleep apnea testing. So we send that and mail that out. So the business model is mailing and then having the patient use it for one night and then send it back. It saves about $1,500 per sleep apnea test from doing it in a lab, because we're not paying for the bricks and mortar. We're not paying for the personnel that are staffing that bricks and mortar. And so this is Amazon.com meets healthcare, if you will, for how do we do this to be able to get rid of the bricks and mortar portion and do it all in the person's home so they can sleep in their home, same bed that they normally sleep in, which gives them a more realistic test. So sleep apnea is typically an age-related disease, not necessarily. You get some very young people and even infants that have it, but to a large extent, it's elderly people. And so, this is one of the things that we've done. As you said, it saves about $1,500 a test from the lab testing, and we've saved payers in the U.S. over $600 million by doing this. So this is a significant change. We're now applying that same model for Parkinson's and movement disorders. We've developed several products for Great Lakes Neurotechnologies is the company's name. It's www.glneurotech.com. And that company has several products that we use for drug testing. One's called Kinesia 1, which has you do a bunch of tests to show what kind of tremor and bradykinesia and dyskinesia you have. And another one is called the Kinesia 360, which is worn on the wrist and on the ankle, and it just monitors you all day long. It has the sophistication and the algorithms to say, oh, I have tremor, or I'm typing, or, do I have dyskinesias, or am I folding laundry? So I'm looking for, different things like that to be able to say, this is how the person is doing during the course of the day without having them to do specific tests, which makes it simpler for the patient. But the third product, which is the main thing we are focused on now, is called the Kinesia U, and that's to be able to lower the cost of monitoring a Parkinson's patient or someone with essential tremor. And it uses a smartwatch and a smartphone, and we have all the algorithms with that. It goes into a web portal that the doctor can see and also onto the patient's phone so they can see themselves. And the big difference with this is now the standard of care for treatment for people with a movement disorder is that you ask the patient to keep log. So if you're lucky and you live in a big city, you go to what's called a movement disorder specialist and you see them every 6 months. If you're not so lucky, you don't see the movement disorder specialist. Maybe you go to a neurologist, and if less lucky than that, you go to your general practitioner because you're way out in the boonies someplace. And so in doing all of that, they may see you every 2 years. So they ask to look at your log. They can't read it because the guy's got Parkinson's and his handwriting is terrible. And so you look at that, and then the physician will kind of set it aside very politely and say, well, how are you feeling? And the patient will tell you how he's feeling, and the spouse will typically say, that's not how he is. And so you go through all of that, and then the doctor says, well, I'm going to have you take 3 pills a day instead of 2. So you go through this titration process, but now you don't see him for another 6 months or 2 years. And so they're improperly titrated for, months or years. They come back again and they're still not well. So what our product does, the Kinesia U, is they send the person home, and in 2 days they know how they're doing because they've looked on the web portal to be able to say, okay, this is, helping, or, I don't know what you're doing at 4 o'clock, but it's not so good. So I'm going to give you another pill at 3:30, or I'm going to change the drugs, or I'm going to, add a second drug, or there's thousands of different permutations of what they can have for the titration of your prescription and therapy. So anyways, he's able to do that. And then every couple of days, over the next week and a half or something, he can find out and optimize that and have the person good for the next 6 months or 2 years or something. So it's a significant difference in the quality of life for the patient. And the good thing about this is in the U.S. that's covered under our what we call CPT codes here, and so which is something we didn't have when we started the sleep apnea testing. We didn't have coverage, and we do for this, so that'll significantly increase our uptake from the physicians. So that's where we are at this point.
That's huge. So as a quick summary, you're looking for areas which have been previously very difficult to actually monitor the vitals and monitor the data, and you're implementing smart technology which is accessible, which is low cost to the end user, and it allows them to collect the critical data, which then enables the health providers, the physicians, the clinicians to say, hey, we'll do this, and it gives them a better patient outcome. Huge.
Right. So it saves the physician time. The patient is much better treated, and the payer saves overall money because they've got a patient that's better off and maybe able to work now, whereas they wouldn't be working before. So that means they're paying into their insurance rather than just sucking it up. And so there's over 90% of these Parkinson's patients are on Medicare. So this is just a huge thing. It's over $5.2 billion of what it costs, and it's about $25,000 a year per patient. So this is, significant costs for the federal government in the U.S. Through Medicare or Medicaid, and so we're going to be saving a lot of money for this once it gets fully adopted.
And at what stage are you right now in terms of this adoption? Are you, because it's
Well,
working, yeah, where are you right now?
right, we've got a couple of dozen key opinion leaders using it, and they like it. And, this is a small company. And so it's a question of we really need a bigger partner. So we're out looking for partners on this to be able to say, we can adopt this. You go through the business models, and within a few years, this ought to be yielding about $10 million a year. And then going up to much higher than that. But the big, prize is for a therapy provider to be able to adopt it and then use it, because our patents, we have almost 100 patents in about 60 issued and 35 or so that are pending. And so of those patents, a lot of them cover the therapy and using it with a therapy and then updating the therapy. And so this allows a drug company whose patents have expired or are about to expire to now be able to extend their patent protection against other generics, to be able to say, okay, you can use the drug now, but you can't use any of that with this device, with the Kinesia U, because that's going to be giving you a much better result overall. And so we think that's a significant advantage in the market for a drug company, but it could be used for advanced therapies like pumps and patches and deep brain stimulation, to be able to then say, oh, you need this advanced therapy. And we've done studies on that and showed that the physicians are much more willing to recommend and prescribe an advanced therapy when they have all of this data.
So you're sitting on a technological golden egg, and now the plan is to understand who's the right person, who's the right couple of organizations to then bring this to a wider scale adoption.
That's where we are. So, we'll see how it goes. But I've been in this business a long time, and so I never get too excited about these things. But this is a really good one, and of all my different companies, this has probably got the best patent portfolio. So we are excited about that. It's not only U.S. patents; it's also international patents. So.
That's really, really exciting. So just to clarify, the specific partners who may be interested in this is pharmaceuticals defending expiring patents for their drugs against generics, and then also therapeutic organizations, so people who are providing therapy for things like Parkinson's.
These aren't therapeutic organizations,
Yeah,
but
yeah.
it's either pills are the primary way you treat this. But some of the more advanced therapies have patches you put on your arm, and it has a drug-eluting patch that then goes through the skin and comes into your body, so you don't have to take a pill, and you can wear them for days or weeks. Other ones have a pump, so you wear a little pump on your belt, and it automatically gives you the drug, or you press a button and it gives you the drug. Or some of them are implanted, doing the same things. You're not wearing it on your belt. And then the last thing is a deep brain stimulator, where you've got what looks like a little cardiac pacemaker, implanted into the chest, and then with a lead going up into the brain, and it stimulates cells in the brain to be able to stop the shakiness, the tremor, and the other two things are tremor or bradykinesia, which is slowness. So, you're kind of moving, it's too slow, or a dyskinesia, which you start to move and then it catches and then snaps out. So I call that the red wine on the white tablecloth problem of, this is a way that most people don't want to be. And so we can solve all of those problems with proper therapy, and we can tell you what the proper therapy should be.
What are you most excited about for the next couple of years?
Well, more artificial intelligence. What we really want to do now that we've got FDA and CE marking on all of this, it's a question of how do you eventually get the doctor to limit their amount of time that they have to spend in the loop. It looks at what the status is and then is able to first recommend and then finally update what the therapy is. So ideally, it's got a closed loop system with a deep brain stimulator or with a pump to be able to say, we're going to increase the pump or turn it back, or the same thing with the deep brain stimulation. Another company that I have is called Neurowave Systems, and we do that, the closed loop system for anesthesia by using EEG and then turning up the pumps or turning them down or off to make sure that the amount of anesthetic and analgesic is proper.
So the aim is to start to build off this foundation, which allows you to analyze and then make suggestions and then update it in real time using AI.
That's exactly it. And so all of our patents cover all of those things, but we're not fully there. And, we've done some experiments in some of this, but, it's not out in the market every place.
Wow, I've got a question in my head which just keeps coming is you've managed to create these innovations through working with highly skilled individuals. You have 5 companies, all which are doing, or sounds like they're doing, very interesting and quite bespoke things. Sleep apnea, Parkinson's. What's very important when hiring people who are going to take on some of the key decisions for the businesses that you're running?
Sure. Well, the first lesson is always hire somebody that's smarter than you are, right? If you're not as smart as I am, and I can do your job, why do I want to hire you? So I want somebody that can do stuff that I can't. And so some of these people have come with their own technologies. The people at Neurowave had developed this closed loop system at the University of British Columbia. And so we licensed that technology and then hired them on. And so, those are things that I always look for. This guy's bringing in an idea as well as a smart person to, do work. And so, that's more valuable, and they get more of what they're doing by bringing it along with them. But either case, we've had some people that, we just hired because they were really bright and sounded like they had good ideas. And so we, hired them and then let them, work on their ideas and try and bring them to fruition.
Is this level of, it's almost like you're an incubator where you're incubating ideas, because you mentioned you went for 8 years without a paycheck, so which suggested a lot of external looking outwards. How can I grow this? How can I build this? Rather than how can I then recuperate it? Does this mean that this has almost built the foundation of the culture of your business, where you're looking for smart people to come in, work on their projects, and then build it to a level that it's ready to be sold? And that's the incubation process where they have a percentage and then you look after the rest. Is this the type of scenario?
Well, everybody's looking for a big paycheck someday, and all of these people are patient. And so the idea is that with each one of these ideas, it's going to eventually be sold to a, multi-billion or $100 billion company that's going to want to pay for it. And then everybody gets, a nice paycheck to be able to, live well for the rest of their life.
Interesting business model. It is a very interesting business model. So you've been around this area of incubation and innovation since 1990.
And I was doing it before for other people for a decade and a half. So, I've got 50 years of doing this kind of thing.
So you got a strong mental muscle of innovation, and
Pay what I've got is paid.
they're synonymous sometimes. They're synonymous sometimes. And so, with this mental muscle, if we're right now, we've been talking about looking back, but looking forward, based on the trends you're seeing and based on being plugged into 5 businesses, you have 5 times the amount of exposure to different markets than someone who's running one business. Where do you see the biggest opportunities are within this telehealth, telecare, remote patient monitoring space?
Well, there's a bunch of different ones. The sleep apnea is obviously the one that's furthest along. We're doing several thousand sleep tests a month. And so, it's out there. The Parkinson's smartwatch system, Kinesia U, is out being used by, as I said, a few dozen key opinion leaders. And so it needs expansion in the marketplace. The next company is the anesthesia monitoring, and so we have a product that's got FDA and CE clearance for called the NeuroSense, and it monitors the EEG and tells you the level of consciousness. So then the anesthesiologist can either turn up the pumps or turn them down, but you've got a person in the loop. We're also doing work. We've been doing it for the military to be able to build new pumps for them, which will go on all the military aircraft for when they're carrying people, patients back from one location to another. So the pumps are semi-automated to be able to allow the patient to be kept in the proper state of whether they're anesthetized or sedated or whether they're just very lightly sedated, but we can do all of that. And then finally, the closing of the loop, which we've done some testing on in Europe and Canada, to be able to, close the loop and take the anesthesiologist. So in our cases, they're just sitting there looking at the screen and they don't need to turn it up or down until they say, turn it off. And, so they've started them up and it goes directly and gives them a bolus of the anesthetic and some of the analgesic and puts them into the proper state. And the problem with that is that you can't over anesthetize a person. So you've got a scale of 0 to 100, and you get typically the sedation is in the 60 to 80 range, and the anesthesia, where you can cut the person and they're not going to wake up on you, is in the 40 to 60 range. But you start getting below 35, and you get into something where the EEG then kind of goes squiggly line, flat line, squiggly line, flat line, which was the heart. You'd be saying you're giving them a heart attack. The brain attack term is used by the stroke people, so we don't use that term. But that's basically what it is. It's very bad for the brain to be shutting it off like that. And so you want to be able to get them down. You've got to get them to about 25 to do the intubation, where you're shoving a tube down their throat. And the gag reflex is about the strongest reflex in the body. So when you put that tube in, the first thing they want to do is cough it and spit it out. And, if they do that and they're sedated, they can drown on their own spit. And so that's not good. So you've got to be able to get that tube down immediately and out of that to be able to keep him, properly sedated. So there's all kinds of issues with all of this. But then once you're going, and then it just runs by itself by looking at the EEG and saying, "Oh, he's starting to wake up. Give him a little more." Or, "Oh, he's getting pretty low. You got to turn it down and not give him so much." So it's all automatic.
Here's a great example of things that I never knew I would worry about if I ever had to have an operation, but now I know. This is crazy in terms of the amount of analysis that's going on and the fine tuning between the upper and lower limit of what's allowed.
And just so you know, the average IQ loss of an open heart procedure is 10 points. So you're going to come out 10 points dumber than when you went in on average. You may not affect you at all. It may be much worse. But by doing this, by improper anesthetics, it will affect your brain over the rest of the course of your life. So, this is important for that. Obviously, you don't want to die on the table, so you don't want to overdose the person. But you don't want to underdose them either. Whereas the CNN did a report on the 10 worst medical mistakes, and this is 5 or 6 years ago now, where they found the number one problem was waking up during anesthesia, and the people are in this tremendous pain because their guts are spread out all over the table as the doctors have got their hands inside of you. And, so you're in this huge pain and you can't say anything or do anything because you're paralyzed during it all. And, so you get post-traumatic stress syndrome, and that affects you for the rest of your life. So, you're not necessarily dying, but, you also have a life that is unpleasant for, multiple decades. So it's very
Oh,
important
goodness.
to keep that anesthesia right.
Well, if I ever have to have an operation, touch wood, I'm going to be giving you a call and asking you for your recommendations on where to go.
So it's NeuroSense and AutoTiva is the closed loop system.
Okay, NeuroSense and Auditiva. So, Bob, I feel like we could talk forever. I have so many questions, but before we close up, I want to ask one more question, which is for people who are younger entrepreneurs, innovators looking to enter into this space, which is a growing market, what encouraging advice or what pragmatic advice would you give to them who are thinking of doing a similar route that you've taken?
Unfortunately, it's not as rosy as what one would think. This the whole thing of how do you make a small fortune? You start with a large one, and this is very difficult. You're going to go a long time without getting paid. You've got this whole thing of, how do you protect all of your information? And in the U.S., we've got something we call the America Invents Act, which passed in 2011, which is killing patent protection. So this is just huge and anti-innovative in the U.S. So actually, England and particularly Germany are much better places to do innovation and protecting your technology. So I guess, one of the things that I would look very carefully if you happen to be U.S. based is that, do you want to go someplace else, and can you get money elsewhere? Someplace like Singapore or other places in the world, because the U.S. is not helpful to you, and Congress has not been helpful for the last 13 years. And so, that's an issue, and a big issue for inventors. So anyway, this is something that it's fun. It may not be financially rewarding. So you have to understand that this is something, you do for the love of it. You do it because you want to make the world a better place. But if you think you're going to get rich out of it, don't put that at your forefront, because you may well be very dissatisfied.
Appreciate that. It's a very well-rounded piece of advice from how hard it is in terms of working in the
Right.
with
I mean,
the
this is the
blocks.
Thomas
Yeah.
Edison thing of 1% inspiration, 99% perspiration. And, so you got to be prepared to work very hard for a very long time.
Yeah, it's I was reading, I'm not sure how popular he is with you, but I think he's a great business person. I was reading Jeff Bezos's 1997 stakeholder update. So he does a yearly update to his stakeholders and shareholders. And he talks about the number one most important quality for anyone building something significant is to be relentless in the pursuit. And I think that ties in perfectly to what you're saying, which is just work, 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 work on something that you love and that you hope will create a better world.
Well, Amazon's just a great example of, they went a long, long time without making any money. So here you've got this multi-billion-dollar corporation that was never made a nickel, for a decade and a half or 2 decades, whatever it was. And so, this is, on your smaller scale for your individual entrepreneur, you got to be prepared to do that. And if you've got, the most important decision a person can make in their life is to choose their parents properly. So to be able to have your parents that have enough money that can finance you through all of this is probably the best bit of advice that I can give anyone. And if they're not that lucky, then they got to be able to be prepared to find out what else to do. So
Choose your parents. Bob, I feel like we could talk all day, but I really, really appreciate your time and thank you for your wisdom, thank you for your perspective, and thank you for diving into such interesting topics today, especially around business model markets and the very exciting future that I definitely see some of your products having.
Monty, it was a pleasure. Thank you.
Thank you, Bob. I'll catch up with you soon. Peace. Bye bye.